fasciitis. Plantar fasciitis is the inflammation in the plantar fascia of your foot. Plantar fasciitis is the most common cause of heel pain. The plantar fascia is a stretchy like rubber band, and it is similar to a ligament in structure, and it is a strong attachment that actually runs from your heel to the ball of your foot and toes. Plantar fasciitis inflammation, which actually means the swelling, pain and tenderness in the hack of your foot, happens when your plantar fascia is being overused or stretched too far. This inflammation makes it painful to walk or use your foot. So anything that damages your plantar fascia can make it swell and tender. Another question someone can ask me is that what are the symptoms of plantar fasciitis? The first and most common symptoms is heel pain, which is the symptoms most of my patients complain about, especially when they wake up early in the morning with their first steps. They feel so much pain and tenderness on the hack of their foot, and also pain in the hack of the foot, stiffness and swelling around your heel, and a tight Achilles tendon. So what are the health conditions that can cause plantar fasciitis? Health condition can range from obesity, having flat feet, or high hack feet. So someone can ask me another question: how is it diagnosed? Most of the diagnosis is based on physical exam. So what I try to do is to obtain the history from my patients. They would often describe that history of pain and tenderness under the hack of their foot, and also if I need to get the severity, I usually get the level of the pain, and most of the time imaging is not required. If it gets to the point whereby we need to require imaging, we can require imaging like X-ray, ultrasound or MRI. So what is the management? Lifestyle modification is very important when it comes to management. Rest is very important, resting your foot. Make sure that you use some over-the-counter meds if the pain is much. Some people have reported that Epsom salt, when you pour some Epsom salt into a warm bowl of water and you dip your foot, I've heard that it helps calm the inflammation, and also icing of your foot really helps. Wearing supportive shoes have been shown to be helpful, and use of shoe inserts. If you get to a point whereby the pain or the discomfort is much, often or most times I just refer my patient to the podiatrist, where the podiatrists have the option of further management like injection of corticosteroids in the foot, or they can actually manage it in other ways. Okay, I hope you are able to learn one or two things from this video.